UnityPoint has a new urology clinic in Davenport, and there's also a new doctor who's leading the practice to serve patients across the Quad Cities. Dr. Joseph Catrone is a urologist and is the leader of the new practice. Welcome to the show, Dr. Catrone.
Thank you. Pleasure to be here.
And welcome to the Quad Cities, because you're very, very new to the area. So give us a little bit more about your background in urology. I know you have interest in really all facets of it.
Yeah, that's what drew me to it, is that there's so much ability to do a breadth of techniques and surgical options, but also you get to be in clinic. You get to talk to people and follow them. So you don't just treat one surgical problem, but you see them for a really long time. So the ability to do a number of operations and surgery and help people in a lot of different ways, and then still get to see those people later on and get to see their kids and things like that,
yeah.
it was a no-brainer.
Yeah, it sounds like it gives you the pleasure to help these people kind of improve their lives and make it better. So give us a little bit more on what exactly urology is. It's kind of an umbrella of many sorts of things with our body.
Yeah, it's a great question. So really anything that involves the urinary system or adjacent structures, and also in men the reproductive system as well. And what that brings with it is a lot of problems. For instance, the top 6 cancers that affect people in the United States, I treat 4 of them. That's 4 out of 6.
Wow, okay.
So there's a high likelihood that you're going to see me, at least at some point, if I'm not proving that something isn't there or finding something for you. So very important when you get that urology consult to make sure you make the appointment.
Yeah, so at what point should we consult a urologist if we're seeing, are there certain symptoms that we need to be on the lookout for?
Yes and no.
Okay.
That's a very good question. And that relates to the most common cancer in men, which is prostate cancer, which affects 315,000 men every year, compared to breast cancer, which affects 310,000 women every year. So, I mean, they're very comparative, especially in the volume. And what is the primary symptom of prostate cancer? There is none. If you're waiting for symptoms, you've already waited for this horse to leave the barn. So it's very important in terms of preventative measures to get in before you're symptomatic.
Sure. So at what age would you recommend men to come in and get their prostate checked?
That's a good test question and a good question as well. So it depends your risk factors. So for an easy answer, 50 years old, but depending risk factors could be 40, or it could be starting as late as 55. Sure.
Obviously, these can be very touchy, uncomfortable, subjects with patients. So how do you approach these issues with your patients?
Yeah, that's definitely a barrier that you have to overcome. And I like to utilize and step back and say, well, what does doctor mean? What is the etymology of that word? Well, it comes from the Latin phrase "docere re," which is to teach or teacher. So my goal as a doctor is to be your instructor. Use my 15 years of education on your side. I'm not here to make your decision for you. I'm here to educate you so you can make your decision.
And you've got the tools and the technology to really help get these procedures done. We were talking earlier about high technology. You've got the technology to really get these procedures done non-invasively.
Yeah, and I mean, that's kudos to UnityPoint by investing in these new technologies, which are going to help our patients in terms of minimally invasive endoscopic or endourology and a number of other options that you don't get at smaller centers. So this is a great place to grow.
Yeah, so talk more about the clinic itself and some of those services that you provide, because you've been at this about 4 weeks now. Certainly was a need on the Iowa side of the river.
Yeah, definitely. And this is a very populated area, and there just isn't a lot of urologists, which is common across all the United States, really. So what I provide is really a general urologist. I don't specialize in one thing. Anything is, available, I would say. Nothing's too big, nothing's too small. So what I would provide is anything from robotics to laparoscopics to minimally invasive to endourology to open surgery or to just a conversation.
All right, so lots of services that you provide. So before we leave this segment, let's talk about the one thing that you want people in the Quad Cities to understand about their urological health.
So if there was one thing I would want people to walk away from, it's to know there is no modesty in medicine. So I don't want to see the doctor because I don't want to talk about this. That is probably the biggest problem that I see, where things could get addressed way sooner if you just come in, talk about it, and realize I've talked about it probably to 1,000 people already.
And you can help them out and help get their problem and their issues resolved. All right, well, the new UnityPoint Urology Clinic is located at 4311 East 53rd Street in Davenport. If you would like to contact Dr. Joseph Catrone and his team, you can do so at the number on your screen. You can also visit unitypoint.org for more information. Dr. Catrone, welcome to the Quad Cities, and thanks for being here with us today.
Thank you.
Useful information for sure.